Foraminal stenosis caused by a bulging disc. I'm going to show you 3 safe, easy moves for immediate leg pain relief. If you have one-sided leg pain from foraminal stenosis, the exercises I'm about to show you could bring you immediate relief. You're going to learn 3 simple moves that gently take pressure off the L4, L5, and S1 nerves. These are the nerves that often are irritated by a closure of the hole, that's called a stenosis, by a bulging disc. The mistake most people make with leg pain is stretching and strengthening the wrong areas. And guess what? You'll be the first to know because it'll start getting worse. These moves are different. They're targeted, they're specific, and they're easy to follow, designed to create space around the nerve at the neuroforamen so you can walk, sit, and move without that sharp, burning pain down your leg. I'm Dr. Gregory Kramer. I have over 30 years of experience of taking care of people with chronic spinal problems, chronic stenosis, chronic L4, L5 disc problems, chronic neuropathy, chronic knee problems, chronic foot problems. And you know how those problems get chronic? Because usually you've had acute trauma that was never fixed correctly. That's a whole nother video. Now, I'm certified in chiropractic biophysics, which is the #1 corrective care or alignment procedure in the world. I use a variety of non-drug, non-surgical methods. Well, first of all, I use spinal decompression in a non-surgical way to decompress the disc, the nerves, and the joint. I also use mirror image exercise, mirror image traction, and mirror image adjustments to change alignment so the body can heal itself. So if you're looking to eliminate pain, stabilize your body, avoid spinal surgery, then very simple. Check the box, like it, and share it. We're always updating our videos. Usually we have a video every week, so you guys know what to do. Help me grow this channel. Just like it and share it and subscribe so I can give you more information every week so you can live stronger longer. All right, everybody, this is Dr. Kramer, and you're going to see the amazing talking finger. So I'm going to give you a rough idea of what a stenosis is. And so what we're looking at is, this is a view, a bird's eye view of your spine, like you're looking down. So just like this is your disc, this is the back part of your spine. So if you were standing, this is your back, and this would be the front. Disc, spinal cord, neuroforamina, these are the nerves. This is normal, all right? We want lots of room for this nerve. Now, if we look to the right, we're seeing a few things happen. We're seeing this bulge or herniation, doesn't matter. It has gone backwards. That's called a posterior herniation. As you can see, it's crushing the spinal cord. Now, this right here, this degenerative changes in bone spurs, that's pushing it this way. No bueno. So we always want to prevent degenerative changes because it takes up space. So even though they might not be painful at the moment, over time, as we get older, 60, 70, 80, 90, if you don't want to be walking all bent over, called shopping cart syndrome, if you want to have strong legs and good feet, we got to preserve the spine. That's a whole nother video, how we prevent stenosis. So these nerves are being compressed. Now, the other way to look at your spine, here's the side view. So I'm going to show you with the magic finger what I'm talking about. So when we look at the side view, this is a healthy disc. We want it fat in the front and fat in the back. So think of this space right here where my finger is. That's the neuroforamen. How we doing there with space? So we have front to back like a room and top to bottom, all right? If we lose the disc height, so long-term ligament damage, long-term disc damage, misalignment, excessive wear and tear, we then get a thin disc with rough bone. As you can see, there's less room top to bottom. Well, that doesn't happen in a vacuum. Usually, there's some thickening of the ligaments in the back of your spine. okay? And when those ligaments thicken, ligament flavum, and when these are your facet joints, when they get arthritic and degenerative, they get thick like a callus. So now we have a ligament thick here, bone spurs here, the disc height getting smaller, that nerve is getting crushed. So we're running out of room. So what we need to do is decompress this. Most of the time, at early stages, we can do it non-surgically. And today I'm going to show you exercises to stabilize your spine. So people ask, well, if it's this thin, how can anything help? Well, the majority of you will find some positions of relief. So if there's no relief 24/7, doesn't matter if you sit, stand, or walk, well then this probably won't help you. But that's not the majority of you. Most of you are worse in one position. That means there are periods of time that you do okay. So I want to expand that period of time that you're pain-free and strong. And we do that by changing stability. That means maintaining in as best alignment as possible. Okay, so again, the reason we can help the majority of you is that most of you have periods of time where you are okay, and that long periods of sitting or standing make this worse. So that's why these exercises work, because when we stabilize your spine, you can handle more stress, whether it's a sitting, whether it's work, hobbies, or standing and walking. And that's what we're trying to do. We want to eliminate pain, stabilize your spine, and avoid surgery as much as possible, and most of the time we can help with that. I hope that clears it up. I hope that explains what we're dealing with when we talk about stenosis of the spine. So here's the key thing. Nerves don't like to be touched. That's key. So if a bulging disc is pressing on a nerve, it can create pain, and that pain travels down the entire path, starting with your butt, can all the way going down to the toes. And so what we're trying to do is to do two things. We want to help pull that disc back from the nerve, and second, open up the space. So we want to pull the disc back, open up the space, stabilize your spine, eliminate pain, and avoid surgery. That's why these movements are so effective. In some cases, immediate relief, especially if your MRI shows a disc bulge, foraminal stenosis, or narrowing of the neuroforamen. Let's get started with exercise number 1. So this is going to be the first exercise for stenosis. These are safe, these are easy moves you can do for quick leg pain relief. So here's the key point to this. Let's assume your right leg is painful, pain shooting down that right leg. We're going to stand against the wall with our left side close to the wall. So right leg pain, left side close to the wall. Second, our shoulder and our hip are slightly against the wall. That elbow stays in to the side, all right? And then we're gonna keep our shoulder straight, and we're gonna gently push our hips sideways away from the painful leg. So this example is right leg painful. Let me demonstrate it. Now remember, it's gotta feel good, all right? So this should feel good. So come with me. So remember, right leg pain, good side against the wall. Elbow stays close to the body. Our feet are away, all right? Now, you're gonna push, take this hand, and we're gonna push. Go as far as you can. It should feel good to you. Hold 5-10 seconds and relax. Okay, if it's not comfortable, you can go less, or you move your feet away. Now, the better the stretch, usually the better it feels. But again, it should feel good. This should relieve that leg pain. So push your hip. Feel that, relieve some of that leg pain. And relax. Push the hip. Hold 5 to 10 seconds. And relax. That's the standing lateral hip shift. So a typical prescription for all these exercises depend on how severe your pain is. So again, if you're in a severe amount of pain, I recommend every hour. 10 reps, 5-10 reps every hour should slowly ease it. Now remember, you're gonna push, but it should feel comfortable, okay? Super important, 5-10 reps every hour if you're in acute pain. If it's chronic, then I'm gonna recommend 3 times a day, breakfast, lunch, and dinner, all right? Doesn't take long, 5-10 reps, breakfast, lunch, and dinner. As the more you do it, you should be able to go further before it becomes uncomfortable. Nothing should cause leg pain, and you're only doing one side with these end range of motion exercises. You're not going both ways. Super important. These are prescription based by your doctor, based on your clinical examination. So it's one-sided only. Exercise 2. This is our prone extension with lateral hip shift. Again, typically away from the painful side. Let's keep to our example, right leg pain. So I'm going to be face down, and what I'm going to do is I'm going to shift my hips away from the right, and I'm going to push my chest up. Okay, let me demonstrate it. So, and I'm going to show an easy version where I just go to my elbows, an advanced version where we're going to extend our arms and go all the way. Again, if you're in acute pain, we're going to do this every hour, 5-10 reps, hold it 10 to 20 seconds. If we're chronic, probably 3 times a day. Now, some of you, if it gives you tremendous relief, some of you can put pillows under your chest to hold you in an extended position. So let me demonstrate it now. All right, I'm going to show the position. I'll be lying face down. This example is right leg pain, and I'm going to show a press up in neutral. Then I'm going to show a press up where I shift my hips away from the painful right leg side. Come with me, follow along. This is neutral position, away from the right leg pain, advanced, easy. This is neutral, shift away, advanced. This is the easy version, shift away. This is the harder version. Easy, harder. This is neutral, shift away. This is an example of we're going to lie on our left side down. We're going to put some pillows at our waist. We're going to create an opening on the right, and this is for right leg pain. Right leg pain, left side down. We're going to use some types of pillows to open up the hole where the nerve is being compressed or pinched. Again, success as it feels good. It's that simple. If you're in acute pain, I'd probably go 10-20 minutes every hour. If this is chronic, try to do a few minutes 3 times a day. Follow along. This is an example for right leg pain, and I'd probably put some pillows underneath my head to keep my head neutral. This should feel good to taking pressure off the right leg. So right leg pain, you're going to be bending to the left. And again, if it feels good to go the other way, whatever relieves the pain. But in general, we're going to put some pillows and blocks to help relieve the pain. All right, now you got a simple daily routine you can use to relieve leg pain from foraminal stenosis. So you got some tools now. What makes these exercises unique is that it targets both the disc pressure, nerve space, giving you a 2-prong approach for fast, effective relief. Now, if you felt relief from this exercise, do me a favor, let me know which one helped the most. Was it the standing lateral hip shift, the prone press up, or the hip glide? I always want to know what you like the best. So if you got value from this video, do me a favor, you know what to do. Like it and share it with someone you know. Remember, people that have chronic pain usually have an undiagnosed disc or ligament problem. Please subscribe if you want proven ways to eliminate pain, stabilize your spine, avoid surgery, so we can build a stronger, healthier spine for life. We all want to live stronger longer. We all want to extend our health span. Now, the next video you should watch is this one, where I'm going to walk you through 3 back decompression exercises for L4, L5 to help eliminate leg pain, and you can do these all at home.